And you're watching JoyNews Prime with me, Ernest Mini. Right now, I want to take you to the office of the former president, John Mahama, who is interacting with many Ghanaians over a number of issues, including COVID-19, the EC registration, and the Green Book. Let's join that feed now.
We must also continue to pray for the speedy recovery of our compatriots who are currently undergoing treatment as a result of COVID. It is sad to note the increasing number of our frontline health workers who have tested positive for the virus. Today, disturbing reports are being received of health workers getting exposed, testing positive, and forced to go into self-isolation, quarantine, or treatment. This is happening at a time that isolation and treatment centers are reported to be full, and both health workers and other positive cases are being compelled to self-isolate at home. This is a sad reflection of the Akufo-Addo's administration's chaotic handling of the COVID situation. Lack of adequate protective gear several months after our COVID emergency was declared is a sad testament of the bungling inefficiency that has characterized the handling of this pandemic from the very beginning. A refusal to be guided by science and a parochial desire for political interest has led government to ignore advice from well-meaning Ghanaians, including the Ghana Medical Association, GMA. Any perceived disagreement with government in its decision-making or published statements or information has been met with savage attacks by government and ruling party officials. This was the experience of renowned pathologist Professor Ajimambedu Akosa, who dared to question the credibility of COVID statistics released by government. It is trite knowledge that you cannot do propaganda with a pandemic. Lining up Council of State members, chiefs, student groups to the seat of government to congratulate the president on his handling of the pandemic will not let the virus go away. The infections and deaths will ultimately expose you. I've been briefed by the NDC COVID technical team about how isolation and treatment centers are filling up, resulting in several patients being asked to go home and self-isolate. Some health professionals are also being redeployed from their original units to beef up management of COVID cases. And this is having an adverse effect on the provision of reliable and quality healthcare service to other patients coming in with other conditions. Admittedly, there's a lot of pressure on health workers and also on our health facilities. We're indeed not in normal times. Do you have a question to ask? Do you have any experiences you want to share, an advice or an idea? Let's get interactive. Use the hashtag John Mahama Live, and post or tweet your question, comment, idea, or experience on Facebook, YouTube, or Twitter. You can also email me at office@johnmahama.org. I appreciate most sincerely the time many of you, my cherished friends on social media, my brothers and sisters from across the country and the world, have spent not only interacting, but also sharing your ideas with me on a wide range of issues, including COVID-19, which is threatening our very way of life. And thanks to my latest initiative, Let's Talk, I've also been interacting via Zoom with many of you who sent in messages with a topic you want to discuss with me. And I've enjoyed all the call-ups that I have had so far. Deborah Lai from Ablekuma West contacted me on behalf of her excited mother. Bright Bell, a health worker. Yao Loku is a private school teacher. Adam, with whom I had an interesting conversation about entrepreneurial finance, and a dozen others. The interactions were heartwarming and very informative. For example, Yao Loku, like many of his colleagues teaching in private schools across the country, is not receiving his salary in full, and he decried the inequity associated with the distribution of COVID-19 food relief in his area, the Kaswa area, during the lockdown. In my Zoom conversation with Yao, he said he did not benefit from the food relief because it was distributed on a partisan basis. It is this failure and inability to competently distribute the food relief and the attendant feedback from especially the vulnerable in society that led to the premature and inevitable lifting of the lockdown earlier than it should have been. Of course, many people were eager to resume normal life because of the economic impact of the lockdown and the government's failure to proportionally reach out to households in the affected locations. I wish to emphasize that the present situation we are grappling with could have been avoided if suggestions offered by well-meaning Ghanaians, including myself, were heeded by government. The Akufo-Addo administration refused to listen to calls to include assembly members and traditional leaders in public education about the disease, in distribution of COVID relief items, and in contact tracing and surveillance. The result has been the disorderly and chaotic distribution of food that caused the lifting of the lockdown. Public education has also been abysmal, and understanding of the transmission of the virus is low. Messages in our major local languages are very few or non-existent in many cases. This is reflected in the total absence of physical distancing in our public places such as our markets and transport terminals. Involvement of traditional rulers in guiding surveillance and contact tracing would have delivered positive outcomes because they know their communities well. The consequence of government's decisions born out of short-term political considerations instead of the science of the pandemic has been the rising number of COVID-19 infections and the resultant deaths we're seeing today. From 2 confirmed cases on March 12th, that rose quickly to 8,548 on 1st June. Today, 17 days later, we have 12,590 confirmed cases and 66 deaths. Reports that isolation and treatment centers are full make the situation all the more dire. While government keeps priding itself with success in testing and has attributed the high rate of infection to the increasing number of tests being conducted, many have expressed skepticism about the accuracy of government's COVID statistics and gone as far as accusing the authorities of massaging the figures. It is recommended by international health experts that as countries start to ease restrictions, it is necessary to expand testing in order to understand the trajectory of the virus. Unfortunately, a strange directive has popped up, issued by the Central Regional Director of Medical Services, requesting all districts and facilities in the region to halt mass testing and test only in conditions when a patient comes in with suspected symptoms of the disease. This has been interpreted by many as an attempt by government to restrict testing in order to show a slower rate of infection. We all have a part to play, all of us, towards ensuring that we protect ourselves and our family and our colleagues from infection. But it is the responsibility of government, more than any other, to ensure that our management of the COVID virus is transparent, is people-centered, and is based on the best scientific advice and practice. My brothers and sisters, health is a human right. The outbreak of coronavirus has shown that a strong healthcare system is vital for any country. The provision of modern, well-equipped health facilities with motivated staff will make it easier for you and every Ghanaian to access quality health care. The NDC party I lead has demonstrated over and over again that it does not talk, it delivers. We are guided by deeds and action and not talk. In our period in office, at all times during the Fourth Republic, we have delivered state-of-the-art regional hospitals, district hospitals, polyclinics, health centers, and CHIPS compounds. And evidence of our delivery abound all over the country. If given the opportunity again by the grace of God and the will of the Ghanaian people, we will continue our aggressive rollout of social infrastructure making sure that every region has a modern regional hospital and each district has a modern hospital facility depending on the demographic and population of its catchment area. I'll ensure that all our citizens have easy access to quality and efficient health care anywhere in our country. In my Let's Talk conversation with Bright Bell, and you can watch that on my Facebook page or on John Mahama TV on YouTube, he brought up the issue of the Onuado mobile vans that my administration introduced in 2015 and which currently have been left abandoned by the President Akufo-Addo administration. These were vans deployed to provide medical outreach services, including dental care, eye and ophthalmic care, mammography, and general care in underserved and hard-to-reach areas of the country. As was noted by Bright, the vans have been left at the vagaries of the weather at the Institute of Biomedical Engineering compound at Kolebu. We would rehabilitate and expand the fleet of mobile clinics and make them available in all our 16 regions so that we can take healthcare to the doorsteps of all our people, even in the remotest parts of our country. We will build a new Onipa Nua hospital ship and deploy it to provide medical services to the inaccessible riverine and fishing communities on the inland Volta waterways. Ladies and gentlemen, my attitude during this pandemic has been to support Ghanaians, including health workers, with whatever I could mobilize, and also to assist government with ideas and possible solutions born out of the technical advice offered by our team of experts and my own experience serving in government. This has been my motivation all through. That has motivated me, our party executives, parliamentarians and parliamentary aspirants, and the NDC COVID-19 team to move around communities and educate the people, provide essential items to our health workers, and also distribute relief food items to Ghanaians. We've also offered many useful suggestions for consideration by government. As the easing up of restrictions continue, it is the duty of government to protect health workers, students, lecturers, teachers, and the public at large. I commend all our health workers, doctors, nurses, field and laboratory assistants, support staff, including cleaners and orderlies, who are all risking their lives to save Ghanaians from this pandemic. I invite you to take a moment to think about the doctors, nurses, and others whose samples are taken after exposure to patients who have tested positive for COVID-19. Think about what they go through together with their families while they wait, in some instances, for more than a week before they receive the results of their test. Just think about the anxiety alone. I believe we can serve our gallant health workers better than we're doing currently. They did not sign their death warrants when they swore their respective professional oaths to serve humanity. We need to inject efficiency in what we do. Government must take steps to curb the long waiting times, which in itself has contributed to the community spread of the virus, including spread at workplaces and among health workers. We continue to hear reports of non-payment of promised allowances and incentives to health workers. It is difficult to understand the delay in such payments, considering that this was adequately budgeted for and provision was made in the money that was drawn down from the stabilization fund with the approval of Parliament. And so it's not like the money is not available. The money was drawn from the stabilization fund approved by Parliament, and it's available for these payments to be made. We must motivate our health workers by paying them a dignifying and commensurate compensation for risking their lives so that you and I can live. I'm aware that adequate supply of PPEs to frontline workers remains a major challenge. And the question is, how does government expect them to work fearlessly if the protective gear, including face shields and other vital equipment, continue to be scarce commodities? There are reports of health professionals having to buy such protective gear out of their own pockets, their own income. And so how can a doctor...
And so that's the former President John Dramani Mahama, who is also flag bearer of the opposition NDC, speaking on a number of issues. But over there, we had him speak specifically about health and asking for more protective equipment for the frontline health workers, as well as teachers and students who have started school already. You're watching JoyNews Prime with me, Ernest Mini. We're taking a break. When we return, Sandra will join us with some more business news.